when we talk about taxation, we talk, oh, taxation is theft. You hear that, oh, taxes are too high. I think the most important thing to recognize when we talk about taxation is that we're talking about welfare, period. Right? Social Security, entitlement spending, for, 600, that is 61% of our federal budget.
Wow.
The debt is 13% of our federal budget. Okay, so 74% of our entire federal budget is Medicare, Medicaid, Social Security, entitlement spending.
So the debt, what do you mean, elaborate?
I mean that when you purchase, like when the government needs to print money, right, they can sometimes, increase money supply in a lot of ways. But predominantly what they're going to do is they're going to sell bonds.
So let me get this straight. We're handing over half our paycheck so the government can pretend to be dad, replace real men with dependency, and call that progress? This is a truth bomb on how the welfare state isn't just robbing taxpayers. It's straight up neutering masculinity. This isn't compassion. It's control. Yeah, taxes are too high, unless you're the government printing monopoly money and calling it investment. Funny how helping the poor always ends with the middle class footing the bill while bureaucrats cash in. Isn't it wild that we work half our lives just to bankroll a system that teaches boys to sit down, shut up, and wait for a handout?
They're going to find ways to get money now that they have to pay back later in some capacity. That has now reached 13% of our federal budget. So 74% of all the money you spend is entitled. We don't vote on that at all. That's not including TANF. That's not including Section 8 housing. That's not including, infrastructure bills. That's not including other forms of welfare. Okay, and when you look at inflation as a form of taxation, and you look at all of the taxes we have, carried interest and, inheritance tax and sales tax and gas tax, it's hard to tell how much it is, but it looks like over 50% of all of the money you make is taken by the government, and overwhelmingly, that's welfare.
All right, so I'm trying to dig into it without getting it too academic. That way we can actually, dig into like the philosophy behind it or whatever. So hold on, you're saying that 70% of the federal budget goes to entitlements. Okay, you're
74.
saying that
61. Sorry.
Okay, so a substantive amount of it is going to the interest on our debt, and we have a substantive amount of interest.
Yeah.
Okay, but at the same time, what we're talking about is, we talk about rights and responsibilities, right, in the United States of America. So we're all about rights. I do love rights, freedom of conscience, freedom of speech, right to self-defense, limited government, all that kind of stuff. I think that's awesome. But when we're talking about our responsibilities to each other, I think that the kids who are coming up, they can't fend for themselves. The old people who are dying, they can't fend for themselves. And so it is the role of us through a collective agency like the government to make sure that children and old folks and disabled folks are taken care of. And that is a perfectly fine role for the government.
So you said it was 61%?
Yeah, 61%
You are
would be
wrong.
That would be Social Security, Medicare, Medicaid, Function 600. What is it now? Is it higher now?
Yeah.
I'm going off to like 2023 data.
As of 2024, it's dated at 63.
Okay.
I was just
I'm sorry. It's even more damn money. So
Okay,
look,
but what's the problem? So that's
let's-
what I'm saying. You're saying 2/3 of it is spent on social welfare. I'm saying that these are things that the government should do. What's the problem with the government doing these things?
Yeah, so we can look as a libertarian, as an ANCAP, I would be remiss if I didn't say taxation.
You're way more
theft.
aggressive on prime time reverie, man. You can tell me to fudge myself.
Well, no. So no, but hear me out here. Listen, I think before we can even have this conversation, we have to understand what has happened historically.
Okay.
Right. And there is this lie that is like, well, if the government won't do it, who will do it? And the thing is that in the 1800s and the early 1900s, we did it without the government. And we did it so fucking well that the government had to come in and regulate and destroy what we were doing because healthcare costs were too low. That is what our government did. They destroyed fraternal societies. In the 1920s, 1 in 3 men in America were a member of a fraternal society. By 1912, 1 in 25 men in America were a member of the Loyal Order of the Moose. You might hear like Moose Lodge, right? And for a half week's salary in 1912, you would get an annual membership and be a member of the Moose Lodge. What did you get for that? You got sick pay, you got unemployment. If you died, your kids went to an orphanage in Maryland where the people that graduated, males made 70.9% more than the average American male. Females made 62.5% more. You had everything that you had elderly care. There was tons of these organizations, and but there was one problem historically, which is that healthcare costs were too low and doctors weren't making enough money.
This part is wild. We're not talking conspiracy here. We're talking receipts. Fraternal societies were crushing it. They offered real safety nets, but they didn't need Uncle Sam, and that was the problem. Can't have independent men helping each other. Can't build a woke nanny state that way, right? Why build community when you can just replace fathers, churches, and doctors with soulless bureaucracies?
So they use the state to crush these institutions.
This is a little conspiratorial for me.
It's not conspiratorial, it's fact.
Okay, you're saying that because it was so cheap that the federal government had to destroy the fraternal societies in order to replace them. Okay, yeah, you're taking facts and then you're like assuming motivation.
No, so I can quote.
Hey, buddy, listen. You talked for like 4 minutes. I want the opportunity to talk as well. Okay.
We said I wasn't aggressive enough.
True, I know that's my fault. So, anyways, the point is that there are also a whole bunch of narratives from the 19th century and the early 20th century, and those narratives were that the working class had to work in industrial tenement housing, that they worked in effectively like corporate housing, that the corporations were fleecing their own workers so they couldn't get by. They had subsistence living. The only way that they were able to survive was through these social networks, and it was a miserable existence. The whole reason why we started these, there was public outcry for this legislation in the first place was because there weren't the things that you were talking about. There weren't
what
workers'
legislation
protections.
Are you talking about? What was their public outcry for legislation as pertains to fraternal
I don't
order
have
societies?
I don't have the name of the specific legislation passed 100 and some odd years ago, but I know for a fact that people were living in tenement housing with extended families. I know for a fact that the living conditions sucked. I know that the pay sucked, and I know that there was an outcry that basically what happened when you were a worker in the late 19th century or early 20th century, that basically if you lost your fingers to an industrial machine, the corporation told you to pound sand. And it's tough luck.
Okay,
That's why these programs were created, was because the corporations were telling young working families to go fudge themselves when they got screwed.
So none of that is an argument against what I stated. What you have said is that in history, at the turn of...
You said it was a federal conspiracy in order to destroy the fraternal societies.
Yes, and what you said has nothing to do with what I said, right?
Well, what I would say is this is how they destroyed the fraternal societies, because it was insufficient.
Well, you already admitted that you don't understand the history of fraternal societies,
No, I
right?
don't.
Which is fine, because
You just made up a position, but go ahead.
Did I make up that position? Or are you saying that you
did you hear me say into this microphone in the past 5 minutes, I don't understand the history of fraternal societies? Did I say that?
Well, you said that you're not aware of what the legislation was in terms of and what those laws were or that process.
Okay, was there
that got
a
rid
law,
of them?
Was
you're
there
saying
a law
it's
in the early 20th century?
Hold on. You're saying that it's a conspiracy theory, right? And then you're saying these laws were passed by public outcry.
I'm assigning motivation that you haven't evidenced. That's what I'm saying.
So let me get into it then. Okay, so again, as I said, 1 in 3 men in America were in these fraternal societies. I gave one example. There are a lot of other examples, but when you're talking about all of these things that are occurring within corporations, within as we move from an agrarian lifestyle into industrializing and et cetera, yes, all of those things are true. What you said is that's absolutely true, but that's not an argument about why we need Social Security or welfare. That is an argument about what we were doing and what America looked like and what were our trials and tribulations in that time, right? Yes, things have gotten better, but that doesn't mean that welfare is the reason that things have gotten better.
Exactly. Pointing out that things sucked in the past isn't a justification for bloated welfare programs now. That's like saying we need government-run dating apps because people used to marry their cousins in the 1800s. It's a total dodge.
We invented tech. We became more industrialized. More people moved to cities. There's a lot of other factors that occur here. My argument specifically is that Social Security that was brought in 1935 under the New Deal was a Band-Aid that has done a worse job of actually taking care of the elderly and taking care of families and community, and that there are a lot of downstream effects that we'll get into later than what fraternal order societies were doing.
I did a cursory search, and cursory research suggests, I'm not saying it's correct, that the Social Security Act was largely favored and ultimately passed because of the Great Depression, and elderly individuals had no access to retirement or means of supporting themselves because the stock market had crashed. So what would you say to that? I mean, you mentioned it's welfare and Social Security wasn't the most effective way to do it. Do you believe that it was a temporary band-aid, a mistake to do? Should the elderly have just figured it out on their own?
No, so what I would say is that fraternal order societies...
Can I be a jerk real quick?
Sure, be a jerk.
Okay. I think you would say that. I think you would say that the private market should have figured it out. I think that you would say that the federal government should not have stepped in. I think you would say that these needs would step up, and then therefore the private society would have taken care of the old people if the federal government hadn't intervened.
Well, so because I'm speaking historically about what happened, I agree with you. Had the federal government not already began the process of destroying fraternal societies in the early 1920s,
okay,
right? So we're talking about multiple things occurring here. So the thing is, the problem is, right? And so just to get into this, right? So when we're talking about the history of what happened with fraternal societies, is that they were using what was known as the lodge healthcare system, right? And so these fraternal societies, they were offering insurance. Eventually, places like the Securities Benefit Association, which there was a protection now through cradle to the grave, right? Like everything that they were doing was they were creating hospitals for the elderly. Like that was the whole point. You pay a half a week's salary for an annual membership, and you have access to a doctor whenever you want, emergency service, all that stuff, right? And then what ended up occurring, because healthcare costs were so low, medical associations began petitioning the government for laws. Okay, they began to say, we have to regulate these people. This is super, super dangerous. These people, many of the arguments that they were making was that healthcare costs are just unsustainably low, that this is going to cause an economic problem because doctors aren't making enough money, because the collective bargaining power of people working together in to have the lodge doctor system was making healthcare costs go down so much. So they petitioned, to bar doctors that use these services from, let me see if I can find
well, I also thought
states here. It's fine.
So here's the real kicker. It's not about compassion. It's about control. It's always been about control. Destroy the institutions that empower men, replace them with dependency, and call it progress. That's the welfare state. That's the scam. Drop a comment. Do you think the welfare state fixed a broken system or broke what was already working? And if you're still cool handing over half your paycheck to fund all this, congrats, you're part of the problem.